Hey guys, Irma here again. Just want to come back and do a new nursing school tip, um, or maybe offer some resources that would help nursing students or future nursing students or pre-nursing students. Basically, anyone who is in nursing school or preparing, taking classes to get into the nursing program. Personally, before we began the nursing program, I began the nursing program. Our program requires students to take all like the AP, the bio, the chemistry, and there's also two specific classes you have to take, which was pharmacology and health alteration. So health alteration basically is just learning about diseases and disorders, and then learning the manifestations, and I think like some basic treatments. It's not really med surg, as med surg is more in depth and related to nursing care. And pharmacology is knowing the medications and the drug classes, the side effects, and those are two prereq classes. And also, as you know, nursing school requires you to learn many medications, drug classes for all body systems, for all types of nursing. And it's not just adult care. You'll learn about pediatric nursing, psychiatric nursing, maternity nursing, community nursing. So there's so many medications, and I know as a fundamental student, I was so overwhelmed. Because yes, pharmacology did prepare me, but in fundamentals we had to learn basically the basic meds, and then going on further in doing nursing school, you have to learn the medications. And now coming out and being a graduate, I look back now, and now I can see a medication drug class by generics, and I get to the ending and know, oh, this is in this class and it has this common side effects. But I want to offer you some resources that I used personally and that I will use now once I'm sitting again for my NCLEX, and I found these in my closet. I have like instead of like there's like a built-in little shelving area where you're supposed to have your shoes and all that stuff. No, mine is all full of nursing books. It is so funny. I just look at it and I'm like, wow, nursing school is expensive. So yes, it's like my prize nursing school textbook wall that I have there. So yes, I'm gonna have the links to these books and resources down in the info bar. I got mine from Amazon. Some of them I won at school. There's three books that I used. One of them that I used from MedSurg or adult nursing, like my second semester of nursing school, I got them. And the other ones I found them like towards the end of nursing school, but they were still really helpful. The first one I want to talk to you about is by Kaplan. It's the Kaplan NCLEX RN Drug Guide, and it says it's 300 medications you need to know for the exam. And if it says NCLEX RN, it's still helpful during nursing school because I mean that's the test that they're preparing you for, right? They're preparing you to be an RN, so it's okay. You can use this. And this just says it has drugs organized by category and subcategory, and including brand name and common names. So on the NCLEX, they took off brand names and now they're using all generic names. And I did encounter that on the NCLEX. It has most known side effects and nursing considerations, and convenient for on-the-go study. It is really small and compact. It is about 312 pages, and I just want to show you just the front page so you can see how it's categorized. So this is a table of contents, and it has them in alphabetical order, and it's by system. So you have allergy and asthma, anticoagulants, cardiovascular meds, GI meds, musculoskeletal, mental health, respiratory, and women's health. So this is just how it works, so you can see. Now I'll just give you one sample from each book. Let's do a common medication. Okay, here we go. So we have prednisone right here, which is a steroid, right? So here's it says anti-inflammatory medication, and it actually has this cool like little cut out. You can actually cut them if you want and maybe laminate them or something. Get fancy, right? Whatever you use, whatever's your best hitch to study, stick with it. Or just try out different ways. So personally, no cartoon will work for me. I like books and highlighting and those things. So this is prednisone. It says anti-inflammatory, and it has also all their common brand names. And then on the back, it just has right here side effects, nursing considerations, and yeah, so all the things that us nurses have to keep in our noggin, right? So yeah, it's prednisone. So that's one sample. So this book I actually won um, when I won my free Kaplan um, review course. They gave me this book, and I did use it a little bit, but not too much. But maybe I'll go back and use it now. But when I did use it, it was helpful when I was studying for my exit classes and stuff. So that's one. My second book is from Lippincott, I think, and it is Drugs to Know for the NCLEX RN. It's like this. As you can see, I went on a journey looking for books. Or sometimes when I go to the store, half price books, they sell gently used books, textbooks, movies, CDs, whatever. Instead of going to like Barnes and Nobles, which is so expensive, I always go here because they have this magical nursing health little department that I just go look for books. And this is where I found this, and this was $12.48. And this says it has more than 300 medications organized by drug class, easy to use format, NCLEX learning test plan, essential coverage of patient safety and education. So I'll just show you the content. And this is by drug class as it said, which is alpha blockers, anticoagulants, antifungals, antineoplastics. So this is better by drug class, which is personally how I like to study, is by drug class. Because that helps when you learn by drug class. You can basically learn any medication. If you look at the ending of the medication, you know what drug class it is, and that's easier for me to learn. So that's the table of contents, and I'll just flip that on it. So here we go. We have it like here. We have, let's see what everybody knows. Okay, so here, like this, for example, it says anti-gout medication. So it has anti-gout, and it has the name of the medication, which is allopurinol, I say this one, colchicine, and probenecid, and it has the indication and the action, adverse reaction, contraindications, and it goes on the other side, and it has a little more in depth on the medication. And this one is a little bit longer, but in my opinion, it goes a little bit more in depth than this one. This is just real basic, which you have to know. This is a little more in depth, which I like a little bit more. And then also in the back, it has avoid common drug errors. And it has about crushing meds, incorrect drug storage, more useful resources back here. So that's this one and this one. And finally, the third one I have, it's really for on-the-go studying and just to help you, it's a memory aid, and I'm personally a visual learner and a auditory learner, so I learn better by listening and doing and writing, right? Yes. So this is Mosby's, and it's the Mosby's Pharmacology Memory Note Cards. And these I'm sure everyone has seen these memory aids on the internet. You can even Google some of these on Pinterest. And it says they're colorful cartoons, perfect for visual learners, quick reference. It says, and it has this cute little character. So many drugs. You need some help. You can see that? And it's a little like flip book, and I'll just give you an example of one. And I've used this a lot. This has helped me through many tests. Let's go and do really a nice one. Okay, so let's just say we have beta blockers, right? It's everyone's favorite medication. Know your beta blockers, guys, seriously. So here's a picture of beta blockers, and it has nice little visual aids to help you remember. So it has the end in LLL, right? And they give you some examples of some, and then the action and the side effect, right? But if you turn them back around, it has a little bit more what you need to know about beta blockers, like the most important, and they even have it highlighted and color coded. So this is awesome, awesome, awesome. And I know many of my friends um, use this, and it's helped them a lot for visual learners. And this is, I'll just show you the content guide. So excuse the notes on top. I was like writing about strokes, I think, at one point. So it's by cardiac, CNS, endocrine, basically all by systems. And you also have psychiatric nursing meds and reproductive medications. So that's cool. And it's all color coded for you. And I know they have many, many more of these, many options of like OB, Peds, a lot of these. If you just look up Mosby's memory note cards. So all these two. So again, these are my 3 resources that I have used, been using, will use, continue to use now until the NCLEX are in. And if you want to know more about the NCLEX and my experience, I have my videos that I've done before. I have some experience, some results of my Pearson view, what study materials I used for the first time with NCLEX. If you have any questions, let me know. Any suggestions of any other tips you have or questions about nursing school or what I've been there, done that. I'm currently right now looking for a job. I've had an interview or two, but I haven't had any calls back. So I'm just gonna move on and continue to search for a job, continue to start studying again for the NCLEX, and just move on, and you gotta get going, you know? So that's all. Have a great day, guys. I'll talk to you later. Bye.